Welcome to Take Notice. I'm Lisa Charney, your host. Did you know 1 in 12 Asian Americans live with hepatitis B and don't even know it? It's asymptomatic and it's rarely talked about. And if left untreated, 1 in 4 will develop serious liver complications and possibly cancer. There's an organization working to bring awareness, testing, and treatment to people most likely suffer from this potentially life-threatening disease. With us today is Richard So, Program Manager of SF Hep B Free Bay Area. Thank you for being here with us today, Richard.
Thank you so much for inviting me onto the show. Really appreciate it. Really excited to take this opportunity to tell people about this important issue in our community and let them know what they can do about it.
I am too, and I'm really fascinated with this because I think a lot of people don't really understand what Hep B is. It can be a little bit confusing. You're going to clear all of this up for us.
You're
going to raise some awareness today. So let's dive right into it. So let's talk about your organization and exactly what do you guys do?
Yeah, so our organization is SF Hep B Free Bay Area, and we work in San Francisco and San Mateo County. And our real goal and mission is to raise awareness for hepatitis B and the liver cancer it causes, really promote regular screening for those at risk, and then navigate people to care for those who need it. We know that seeking care, especially with language barriers, can be tough, and so we also do that as well.
What is Hep B? I know we've all talked about and we've heard about Hep B, A, C. Yeah. So let's clarify what that is. Let's focus on Hep B. What exactly is hepatitis B?
Yeah, that's a great question, and we always hear it out in screening and teaching, educating the community. So hepatitis B is a virus of the liver. That's what hepatitis is. Actually, all three are viruses of the liver. This one particularly happens to be more prominent in the Asian population as well as the African immigrant population. It affects the liver. It is contracted through blood and sex. The most common way it's contracted is, at least in the Asian community, is through mother-to-child transmission during birth. And that's also the most dangerous, that causes the chronic version of the disease that makes you 100 times more likely to get liver cancer.
Oh, okay.
It is a virus that sits in your liver and slowly causes damage to it. And then because of it, 1 in 4 people who have this chronic disease will develop liver cancer or serious liver complications that usually results in, unfortunately, death.
Wow. Okay. So, and then what are the differences with A and C?
Yep. Great question again. So hepatitis A, you may have heard of in this past year, San Diego had an outbreak of hepatitis A among the homeless population. So hepatitis A is an acute disease, meaning you don't keep it lifelong term. You've heard of chronic back pain, that means long term. And it is where you'll see it is infection is caused by contaminated usually food or water. It's fecal-oral transmission. So it's from human waste to people ingesting it. So that's why in the homeless population, or sometimes it comes out from restaurant workers, from that unfortunate incidents similar to E. coli. But when you have that disease, you might get the sickness scale is at a minimum. You might think you just have a flu, kind of fever, cough, that type of thing, and not realize it's Hep A, to being hospitalized for a month or two, but ultimately your body will pass it.
Oh, wow, okay.
And you'll recover from it and you'll get immunity. So hepatitis A also has a vaccine that you can get, and then you're protected from it. I suggest everybody get it, because who wants to be sick?
Yeah.
So that's Hep A.
Okay.
Hep B, I already told you a little bit about. The difference is Hep B can be contracted in an acute form or chronic form. The acute form, if me or you were to be infected today through, let's say we work in a hospital and got blood needle stick, or for those, unfortunately, during the opioid epidemic, sharing needles, you would get an acute form similar to hepatitis A, where at the small scale you might not even know it's hepatitis B. On the worst scale, you could be hospitalized for 1 or 2 months. But the potential for liver cancer is much lower, and your body would recover from that. The dangerous part is this chronic version of Hep B, and that's, you're much more likely to have that version when you catch it when you're young. Actually, the data shows that as you get older, it's kind of like one of those curves that when you're very, very young as an infant, your likelihood of converting to chronic Hep B is 95%. As you get older, that percentage switches so that by the time you're in your 20s, if you were to become infected, it's 5% or less for that to convert to the chronic lifelong version.
Okay.
Hepatitis B also does not have a cure.
I was going to say, because if you had mentioned the A is curable.
So hepatitis A doesn't have a cure,
okay.
but they'll treat the symptoms and then your body will naturally recover. It's called self-resolving.
Okay. Yeah. So if it's not curable, can you and you do get it? Is it recurrent? Like, are you susceptible to get it again?
Good question. So for hepatitis A, you don't. I'm not exactly sure, but I'm pretty sure you don't get it again.
Okay.
For hepatitis B, you won't have like what you might call a flare-up or something unless you become immunocompromised. So the only time you really see it is if people, if you get a liver transplant or if you have another immunocompromising disease or if you get put on steroids for a long time or there's some drugs that people take before surgery. So we know for a fact that we have some allies who do liver surgery work in CPMC in San Francisco, and a handful of people suddenly fall into liver failure, unfortunately, that's life-threatening because their Hep B kind of, we'll use the word flares up, because they're on immunosuppressive therapies to prep them for that surgery.
Okay.
And so to stop that, we just need to make sure that those surgeons check for Hep B status before their patient gets prepped for surgery and starts that whole process of
And what about C?
So hepatitis C is probably one that most community members have heard about. A lot of the baby boomer generation, they talk about it in Congress. There's been some work in New York. And that was because it is also a bloodborne disease. And a lot of baby boomer generation people contracted the disease when blood transfusions weren't screened. When blood was first donated, the first thing people checked for was HIV, but hepatitis was something that came a little bit later. So people were getting blood transfusions after surgery and being infected unknowingly, and with the medical profession not really knowing either. And so you got that, and then you do see hepatitis C infection a lot in the sharing of needles for the opioid crisis. Hepatitis C is a chronic disease, much more similar to hepatitis B, and it does cause liver cancer as well. But the difference is hepatitis C has a cure now. I'm not sure you probably heard in the news as well. When it first came out, it was $100,000 for the cure. Then for the longest time, it was $85,000. And people were like, how can a patient afford this? And the pharmaceutical kept saying, well, it's a cure, so it's not like a drug you're going to have to buy over and over again every day. That's it, and it takes us, all these years to do the research. And so that pricing has come down, but yes, there is a cure for Hep C.
And let's talk about the nationalities that this affect, because I'm really fascinated with why it seems it's more prevalent in certain nationalities.
Yes.
Let's go over that a little bit.
Yeah, right. So you might not have heard of hepatitis B because it is primarily, in the world, the burden is an Asian issue. And that's not something that scientists think is DNA driven, but probably much more a factor of the amount of people in that country that have this disease, and now, so when they emigrate to other countries, that the chances that they bring that disease with them is much higher. And so if you look at a world map, you can see that the rate of hepatitis B endemic in that country, so the percentage of people in that country that have chronic Hep B, is somewhere between 2 to 10%. In certain parts of Asia, it's a little bit higher, gets into the 15%, which is a lot of people, a high percentage of this population. And so that includes the largest burden of Hep B and liver cancer is in China, but this is Thailand, the Philippines, the Pacific Islanders, so Tongans and Samoans. We know there's large populations there up and down the peninsula. India as well. The Middle Easterners have like lower threat, but still in the 2 to 5%. And then African immigrants as well. A lot of those countries that have very still developing healthcare systems, this rate is high there. In fact, pretty much everywhere except Northern America and Western Europe are the kind of lower than 1% rate. And actually the CDC and WHO suggest or recommend that everybody from middle threat to high threat endemic places get vaccinated and screened and vaccinated, because why not, right? Low cost, and the vaccination can protect you for life.
Okay, so since we're talking about location, how is this affecting our county? I know that you're trickling down to the Bay Area because you were SF Hep free, but now we're broadening it, calling it Bay Area.
Right.
So are you trickling down the peninsula to the San Mateo County? And what are the percentage? Let's talk numbers about our county and how it's affecting us here locally.
Yeah, so about a year ago, we expanded from just being San Francisco County based, and we were looking, well, of course, there's so many more Asians at risk for this disease in the Bay Area that is filled with Asian immigrants. And so we looked at San Mateo County and said this is a natural segue. We know San Mateo County has at least 200,000, I think by the 2017 census estimate, 200,000 API population.
Okay.
And
can you explain what AAPI is?
Sorry, yeah. So API stands for Asian Pacific Islander.
Okay.
And they're grouped together, and that does often include Indians from the country of India as well.
Okay. So it makes sense that you are focusing in our county.
Yes.
It just the numbers make sense to where there's a need.
Right, right. And a recent study actually out of the Asian Liver Center at Stanford University estimated that about 10,700 people in San Mateo County are probably living with chronic hepatitis B.
And don't know it.
And most, 2 out of 3 people who have this disease don't know it. And you might be asking, well, how could you have such a serious disease that might cause liver cancer and have no idea?
Yes, it's asymptomatic, which means that it doesn't show any symptoms, and a lot of people live with this and don't even know it.
Correct.
So, I mean, when we say that, how does somebody, is it too late by the time people, before they know it?
Right. So we call this disease, unfortunately, a silent killer, and the people who have it are ticking time bombs. And that is because...
That's scary.
Yeah. Unlike other diseases, most people, the vast majority, in the 90%, don't have any symptoms. You're not going to feel sick. People say, oh, well, won't I turn yellow like jaundice when they see that on TV and such? But for most people who are infected with hepatitis B that hasn't developed to the liver cancer yet, will have no symptoms until it's too late. And what I mean by too late is by the time you have physical pain, usually that will mean you have late-stage liver cancer, and the prognosis is somewhere between 6 to 12 months or 6 to 8 months. And so you unfortunately have a lot of patient stories where it's simply, someone in the 30s, 40s, 50s who, on a Sunday is eating brunch with their family. Then they suddenly have some stomach pain. Oh, maybe appendicitis. Maybe I have a kidney stone. Something weird going on. Let's go to the doctor, make sure nothing's bad's happening. They go and get a scan, an MRI, and the doctor comes out with this look of disbelief and says, actually, we found these huge masses in your liver. You have late-stage liver cancer. Our best guess is that you have 6 to 8 months to live. And, and people are just floored. What do you mean? Lots of these people do exercise.
Sick. I never
don't feel sick. I don't drink. I don't do drugs. And the doctor will say, hey, well, we did some tests. It looks like you have hepatitis B. That's actually makes you 100 times more likely to have liver cancer. But why wasn't this found out before? And one of the tragic things is hepatitis B testing is not in the normal annual physical that any person goes when they go, hey, doc, give me my annual test.
Really?
So you might ask why, when this is such a threat.
Why?
So unfortunately, in the United States, only 5% of people are Asian. And so for cost effectiveness, all these regulations that are built, it just hasn't been something that's been built into the annual physical that is kind of mandated by the federal government. One of our kind of pie in the sky goals is to make that, to change that for California.
Absolutely.
In a state with 20% plus Asians. It should be something that doctors say, hey, you checked off this box, you're Asian American or born in another country.
Yes.
Let's do this test. It's cheap.
And as our demographic changes, I think so should medical practices and testing and things like that. And it's very easy.
Right. So we as a group do in-community screenings. We show up at health fairs and different cultural events, and we'll do education and also do that free screening that you don't need to pay for it. There's no insurance that we look for. We don't look at immigration status, and we just work with community health partners, places like Stanford, places like CPMC, places like Northeast Medical Services.
Okay.
And then they will get their results in the mail. if they need to get vaccinated. So let's say they look at that test or they just know that they haven't been vaccinated. We unfortunately don't provide that service, but we have connections with those healthcare services, healthcare providers, even with the county itself, and we can direct people to get that vaccine. And fortunately for both the screening and vaccination, it's covered under Medicare, Medicaid, and all insurances as a preventative service. So if you ever get charged one of these, call me and we'll sort it out.
Okay.
Because it's supposed to be, you're not even supposed to need to pay a copay.
Oh, wow.
Now, if you're uninsured, there are a variety of options. The county has some programs. There's something called the ACE program, which is kind of like the county's safety net primary care provider, and we can help patients navigate that. There's some free clinics around, and we all have connections and resources there so that when you reach out to our hotline, which you have to call and leave a message, but we can respond in Cantonese, Mandarin, and English.
Oh, which is also helpful too, because I'm sure that's got to be some kind of barrier for a lot of, that group.
You talked a little bit about navigation, and of course we know across healthcare, one of the hardest difficulties is people who aren't English fluent speakers trying to navigate the American healthcare system. So that was one of our big priorities. So we have that navigation line with the Cantonese and Mandarin speaker, and we also partner with Northeast Medical Services, which focuses on the Chinese community and always has providers that speak both Cantonese and Mandarin.
Oh, that's great. So, so your normal person's regular doctor should be able to screen them for that. So anybody can ask their doctor for the screening, and they should not be denied.
Yes. So that's one of the biggest things we suggest. We always joke when people come up to our booths at events, just email your doctor or call your doctor, say, hey, these Asian people said I should be really scared of this disease.
Oh, no.
And say, do I need to worry about it? And then the doctor should be able to just check their vaccination and check whether they've been tested before. Now, a really important caveat to that is vaccination records aren't always, the best, and especially vaccination that may have been done in other countries. We just don't know. So we do say, ask your doctor for your status or your result of a test. Don't necessarily just rely on that yellow piece of packet that people carry to their doctor that has their vaccination records. And because, if you have good insurance or regular insurance, that test again should be free. So we say there's no harm in getting retested to make sure.
And what is the test?
So unfortunately, Hep B doesn't have a prick test like you would for blood sugar. It is a blood draw. But it is simple, takes about 2 minutes. Doesn't really hurt. It's the same as when your doctor draws blood. It's actually less because I think on a normal blood test, they draw like 2 or 3 tubes sometimes. This is just that one, sends it out to the lab. You should get your results right away within a week.
Results are fairly quick to get.
They should be.
It seems like it's very easy nowadays to get the answers. So why aren't people getting the answers and finding out if they suffer from this?
Right. We ask the same question all the time.
I'm sure
Why aren't people getting screened?
I'm sure you do,
But we think it's a combination of several factors. One, there is still stigma in the community, especially.
And why is that? Let's talk about just a little bit. I want to touch on what that stigma is, because that goes way back.
So unfortunately, the stigma exists a lot from leave behind from the former countries that these immigrants are coming from. We know that, especially in China, as one example, this used to be something that people were discriminated against, something that on job applications or when you were sending your children to school, they had this question, are you infected with hepatitis B? And of course, it wasn't you could just say, I don't want to answer this question, but then they would find some excuse not to
That was a red flag if you didn't answer it.
And that was because there's this huge misconception of how you can get the disease.
Like it was contagious.
Yes, like I said, it is contagious in the sense that you can get it from blood contact and sex contact, but people were thinking, when my kid plays with your kid, he's going to get Hep B. When my kid eats with your kid, he's going to get Hep B. Share the same bathroom. And you saw this even, sadly, within families. Oh, we've had people come up and say, oh yeah, my uncle has this disease. He sits at a separate table at dinner time, and we separate the food. And of course, so nobody wants to experience that in their own families or in their own communities. People get in relationships. Your boyfriend has Hep B, oh, you can't date that person. And we know we've had stories from advocates that we know in China who this has exactly happened. The parent found out that this to-be spouse had Hep B, broke off the relationship or broke off the engagement. So that mindset comes here. So that's changing now with
so education is key for you guys.
Yes,
I mean, that's probably part of your plight.
Yes.
Is informing people and educating them that's not really the case anymore.
Right. And so that's one of the things where we first say, no, this is just going to be transmitted almost always in our communities from mother to child, and then that has nothing to do with sexual contact. That has nothing to do with promiscuity and any of those kind of stereotypes or those misconceptions as well. So
let's say that a potential person that could be suffering from this is pregnant. And they are carrying a child.
Right.
Is that treatable? Is there a way to detect that a newborn may have it?
Yeah, so fortunately, and why we don't see a lot of young people who grow up in the United States having hepatitis B is in about 1992, 1993, the CDC formally recommended that pregnant mothers be tested for hepatitis B, and if they test positive, that infants who are just being born get given a dose of a booster called HBIG, which prevents the transmission completely of hepatitis B from mother to child. And so now, more or less for those young people born who are 27-ish years old or and under, or people being born now, that transmission, if you're born in a hospital, is pretty much been eliminated. For people like me, I'm about 31 right now, and so I was still in that, born in 87, so it's still important for people my age to get tested because you never really know when those hospitals put those recommendations in place. But because that has been the relatively norm now, for those mothers, although they may need to start treatment for their own hepatitis B, that has not been passed on to their child, so their child does not need to worry about it, but should still get vaccinated. You may remember, for many of you who are watching, the hepatitis B vaccine is one of those required vaccines for children to get to start school.
Right.
Right. And so in that sense, a lot of people are protected, but that does leave a category that's less talked about that's important to note, and that's if you already have the disease and get vaccinated, it's not a cure, it's preventative. So we do have a population of people who maybe are born elsewhere or born a little bit in their 30s or 40s now who were infected at birth from their mom, but got vaccinated when they started school. And so now, unfortunately, they're walking around thinking, hey, I got the vaccine, I'm protected. But really, that's a false sense of security now because they're still infected. And there's an interesting story with somebody who actually volunteered for our campaign. She was a nursing student, and she had come out to maybe 10 different events, always advocating for this, for our work. And one day they were doing a photo op and had her take her blood for the screening and said, why not just send your blood results in? She had always said that she was vaccinated and safe, and her blood results came positive back for chronic Hep B.
No, really?
And we were dumbfounded. What's going on?
All of you, yeah.
You've been working with us for months.
And
you know, we talked to bring her over, and we talked to her. She says, hey, I was born in Vietnam, but I moved to the United States when I was maybe 1 or 2, got the vaccines starting school, and so I thought it was okay. But she happened to be in that small population that had it.
Before the vaccine? Maybe that she had it before
she didn't get the vaccine at birth in Vietnam. So contracted the disease, very likely from her mother. And came here and then got vaccinated, so she thinks she's safe, but she already has the disease. And so that was just a real-life example that we experienced of catching someone who would have been at risk.
That's a really good example. Now, let's circle back to that. Now, in a case like that, would it make sense for her parents now to get vaccinated or to get tested?
Yeah, so they should double check to get tested, and then they would probably start that treatment, which is very simple, and that's one of the great things about Hep B. Treatment is as simple, when it's not liver cancer, as monitoring. Going to the doctor, depending on what your doctor says, once every 6 months or once per year, you get a couple extra tests that tests your liver functions and things like that, and the liver, and the virus count. And if your doctor feels like it's appropriate, then they will start you on a drug that you take a pill once a day for the rest of your life that keeps the viral load down. And most people on that management treatment will live full, healthy lives. So
it's treatable and manageable, but not curable.
Yes.
Okay.
Correct.
And people can live healthy lives.
Yeah. So unlike some other diseases, it's not a death sentence. You're not going to have this hugely reduced quality of life. And that's why we're out here again. Like, this is something, if you just catch, you can either get vaccinated and be protected for life, never have to worry about it again, or just start this very easy, not ridiculously expensive medical course of a pill a day and be fine.
Interesting. And I also want to talk more about your organization. How are you guys funded?
So we do get funding from a variety of sources. We graciously get funding from the county of San Mateo through Measure K funding.
Okay.
We do get funding from some organizations like the Peninsula Healthcare District and Stanford Healthcare, who's one of our partners doing work here. And we also do get some funding from Gilead, which is the pharmaceutical company that does produce the treatment, but they have no say in how we use that money. And then for the grants, we do projects that individually are grant funded.
That was very eye-opening. Thank you so much for shedding this light on such an important topic. It's important for people to know that Hep B is easy to detect with proper testing, and it's treatable and manageable. If you or someone you know needs to be tested, don't hesitate to contact SF Hep B Free, Bay Area, at the website listed, and we've also put the hotline number down for you to call as well. Thank you for tuning in to this edition of Take Notice. I'm Lisa Charney. Have a safe day.